Hi guys, this is Caroline Peregrina out of California. I just want to say thank you so much to everyone who have subscribed to my channel, commented, commented on my posts on Facebook about the channel, and you really guys have inspired me to create more videos like this. When I first started this channel, that was just like Saturday, February 1st, 2020. I never thought that I would create a channel in a million years. It was a sudden urge to do that because I saw a post of a nurse practitioner struggling and accepting that she is completely capable of treating patient as after graduating as Psych NP, and I know that struggle all too well. And I think we need a voice out there so that we can empower each other through my experience from that transition and throughout my psychiatric NP journey. So if you are new to this channel, this is all about you being able to learn to value yourself, being able to assert yourself as a Psych NP, and be able to believe in your abilities and capabilities as a psychiatric nurse practitioner. So this is what this channel is about, and if that is something that you would like to learn more about, please do subscribe to this channel so that you can get notification for new videos that I will be uploading. And I do have a big list of lineups for you guys to learn more about being a psychiatric nurse practitioner. Also, this is my fourth video of the week since I started this channel, and I'm really excited to talk about it because it's also something that a lot of nurse practitioners struggle. There is a question that is all too well known for us, and that question is, what is the going rate for psychiatric nurse practitioners in the area? And you probably have asked that, have heard of that. I have too. I asked that, before I graduated as psychiatric nurse practitioner. And there is a lot of wrong about that question. There's probably only one good thing about that question, and I'm going to tell you why. And so make sure that you stay tuned. So I'll talk about it in a little bit. Okay, so let's talk about the topic. The question that we all know too well is, what is the going rate for psychiatric nurse practitioners in the area? Okay, so there's two things. Well, there's a lot of wrong thing about that, and there's only one good thing about that. One good thing about that is it is a point of reference so that we have an idea of what nurse practitioners are being paid in your area. That's the only good thing about it. It's just a point of reference. That going rate does not tell you your worth. Okay, so I want you to remember that it is just what is the average pay of a psychiatric nurse practitioner in the area, but that does not put into factor your worth and other things. So that's all I want you to remember about the going rate. So the other things that's wrong about that going rate is that a lot of nurse practitioners come out thinking that this is how much they should be paid as a psychiatric nurse practitioner. Remember too, the going rate is average. It's an average, right? And there's two reasons for the going rate. Two factors that makes the going rate. One is what the company is willing to pay nurse practitioners. Of course, based on, it's going to be probably on the low side because it's just understandable. Companies, they are a business. They want to earn profit. And the less they pay their employees, the better profit possibilities for them, right? The other is that it comes from what we accept, what a group of nurse practitioners accept as a payment structure within that area. And it does not represent really a lot. To me, it does not represent your worth. So what I want you to think about is that a lot of nurse practitioners accept this going rate because they think this is how much I should be paid because that's just how it is in the area. But remember what I told you in the first video or the second, you need to know what you're worth because every single nurse practitioner is not comparable to another nurse practitioner. A person's experience as a psych nurse, 1 year experience is completely different than someone who has a 15-year experience as a psych nurse with specializations in a lot of different, subspecialty of psychiatry, right? So that does not allow to factor in your specific skill and specialization. Also, when you accept the going rate, you just devalue your time being away from your family when you're in NP school. What I have found is this going rate is usually about the same as your RN pay or a lot less. In California, I was blown away by what was the going rate when I graduated in 2015 for a nurse practitioner. It was actually $20 less than what I was being paid as an RN. And it did not make sense to me because as an NP, we have more responsibility. As an NP, we definitely have more skills, right? As an NP, we're writing those prescriptions. And those could be dangerous, right? So that's a huge responsibility on us as an NP. And why are we being paid $20 less than RNs? So that didn't make sense to me. Also, when you accept the going rate, that kind of seals the deal that this is what nurse practitioners are allowing other people, are allowing themselves to be paid. So it sets up other nurse practitioners for the same, right? When you also accept the going rate, you also devalue the time that you were looking for your preceptor when you were in NP school. Most of us nurses, when we go, extra degree, master's or DNP, we're all working RNs, and we already have families, children that we are supporting. Okay, so you spend a lot of time working, going to school, doing your homework, doing your clinicals, spending a lot less time with your family because you want to better your life. That's the hope, right? You want to better your life, and you want to be able to hopefully have a much better pay structure, much more freedom, and then you come out being disappointed because it's almost the same as being paid as an RN, if not a lot worse, really. The accepting the going rate just devalues a lot as being a nurse practitioner. So please, when you are asking about the going rate, just use it as a point of reference, because it is not how much you should be paid. How much you should be paid should be based on what you think you should be paid. Of course, I'm not saying you should ask for an exorbitant amount like $1,000 per hour, nothing like that. But, more than what, the going rate is, maybe $10, $20 per hour more than your RN pay. You should not go backwards. You should go forward. And I'm not saying that pay is the only thing that makes us, choose a certain job or accept a job, but that's definitely one big thing, right? And what I have seen is that a lot of NPs, because of this imposter syndrome, because of this new grad thing, they think that they've got nothing to offer as an NP, therefore I'll just take whatever they offer me. So please do not go and do that and get into that trap. One thing that I've learned is that you will never get what you want if you don't ask. So going into the workforce as a nurse practitioner, I already knew what I want to be paid. And at that time, a lot of people, recruiters, would tell me, oh, that's not the going rate. Oh, that's not how much I'm paying my current nurse practitioners or my current PAs. And like what I told you in the other video, I stay silent because the nurse practitioners there, the PAs there, they are not me. And what I'm putting into the table, it's different than what they're putting on the table for this company. So make sure you already know what you want coming out of nurse practitioner school and how much you want to be paid, and assert your worth. So I want to tell you a story about an experience of mine where a job that I accepted as a nurse practitioner. Like what I said, I already knew what I wanted to be paid. And I told this person, the hiring person, how much I wanted to be paid. And of course he told me that's not how much I'm paying my NP. And again, it's quite offensive to me. And so, but I tell him why I wanted to be paid this much. So we bargained or negotiated, and we came up with an acceptable rate for me. So I started also at the same time with another provider, another advanced practice provider, nurse practitioner in that same company. And later on, we started talking, and we kind of talked about our pay. And I found out, and she found out, that I was being paid $30 more than her. And that blew my mind. So do not get into that trap of this is the going rate, therefore you should accept it. Please. That should just be a point of reference. Your goal is what you want to be paid. Another story is insurance. Some of you may be in private practice or thinking of private practice as a nurse practitioner, depending, I guess, on the state. But here in California, you can directly apply to be an insurance, to be accepting insurance in your practice. And again, insurance is a business. They will, of course, give you the lowest rates. And if you accept that, then there you go. That becomes the going rate, right? Sets up other NPs coming in, because that's how much this nurse practitioner is being paid in your area. So when insurance give you a rate, it's usually one of the lowest rates, right? And it's really important that you also counter. Maybe not counter, but say this is not possible for me. It's actually my own experience where I submitted an application for an insurance to be paneled with them. They got back to me. They wanted me to be paneled with them, but they gave me a very low rate where it's not possible for me to maintain my business. So I did respectfully decline, and I said I'm gonna have to cancel my contract with you because it's just not possible for me to maintain a business having this much rate. And I didn't expect them to do anything, and they said, well, this is again the going rate of nurse practitioners in your area. And so I said, I respectfully decline your contract and your rate, so please terminate it. I did not expect them to come back to me and give me anything. I wasn't expecting that. I just wanted to terminate the contract. But they came back 3 weeks, maybe 2 weeks later, and said that we worked it out and this is the rate we're going to be offering you. And lo and behold, much better. If I didn't ask, I would not have gotten it, right? So again, this experience is for you guys to understand what is it that you can assert, what is it that you can do when you're faced with this situation, when trying to find a job and trying to negotiate for what your worth is, okay? Do not devalue yourself at all. Again, that is my entire message, is do not ever devalue yourself. You guys are amazing RNs already. You're increasing your knowledge because of a lot of reasons, family, freedom, or because you want to empower yourself to be able to treat patients and have that ability to do so without, asking for orders from anyone, right? So just a summary of what we talked about. The going rate is just a point of reference. Your reference should be what you think your worth is based on your experience, your specialization, what you bring to the table, and who you are as a person. And you will not get what you want if you do not ask for it. Have a plan in your mind how much you would like to be paid, and go to that interview with that hourly rate per patient, whatever that may be, of this is how much your value is, okay? So hopefully that helps you. If you would like this video, please make sure you subscribe, like, and also comment if you have experienced this yourself, and maybe give us inspiration as to when you bargained or negotiated, what happened, because that will empower a lot of nurse practitioners when you tell about the successful experiences. I will be talking about a lot of other things I'm going to talk about interviewing skills, perinatal mental health, which is my specialty, and so many different things to give you guys the skills and empower you as always. Okay, thank you so much. Bye.